Okay, we're gonna go ahead and cover the biceps brachii and how we go ahead and take care of that with our trigger point therapy. So the biceps brachii is a two-headed muscle, so it has two different origin points, but it has a common insertion point, or the same insertion point for both of those. So for the short head, or the part of the inner bicep, its origin point is gonna be on the coracoid process of the scapula. And its insertion point is going to be the deltoid, or not the deltoid tubercle, excuse me, the radial tuberosity of the radius. And then for the long head of the biceps, which runs along the outside here of the bicep, that is going to have an origin point of the supraglenoid tubercle at the top side of the glenoid of the scapula. And when I go about working this, I have to keep its action in mind. So the action of the bicep would be to supinate the wrist, to flex the elbow, and also the long head of the bicep helps in shoulder flexion. So I want to do the exact opposite to fully stretch this muscle. So I'm going to have her in this position here, shoulder extended, and actually I'm going to have her pronate her wrist, just like so. And so now you can see we have pronation of the wrist, we have elbow extension, and we have shoulder extension. So this is full stretch of this muscle, and I can apply pressure here as need be. And I'm going to work on the upper portion of the long head of the tendon of the bicep. So I'm going to go skin on skin. Go ahead and roll that up for me. Perfect. We're going to be down here just like so. I'm going to apply a little bit of emollient here, which that was like way too much. And then I'm working all the way across here. And just make sure you're kind of playing around both medially and laterally, just so make sure you're directly over the long head of the bicep. And you will feel the difference in the tissue. So right here, I can feel that I'm right on that. How's that feeling, Kristen?
A little tender.
A little tender. So this is the first way that we go about addressing the long head of the biceps tendon, specifically at its proximal part. But we can also have the patient, go ahead and sit up for me, Kristen. We can work the distal part of the biceps or other parts of the biceps with the patient seated. So I'm gonna put a little bit of this emollient here. And for this position, I have the patient with the shoulder extended right here, and they're gonna start with their arm in a supinated and flexed position. And I'm going to have actually explain to her that I want her to keep her shoulder in this back position here, extend the elbow, and pronate the wrist. So flip that wrist and extend the elbow backwards. And then I'm going to work with both of my middle fingers, just like so, in order to find different trigger points on the bicep, working my way up and down it. Kristen, go ahead and extend your elbow and pronate your wrist. Good, go ahead and come back up. And so as you can see in this position here, instead of me passively moving the patient, I have the patient actively move for me, and I address the trigger points as they need them. Perfect. All right.